Welcome to the committee, Ms. Fitzsimmons. If you would just introduce yourself for the record and present your testimony.
Thank you, Madam Chair and members of the special committee. My name is Alexandra Fitzsimmons, and I'm the Senior Policy Director with Children's Defense Fund Minnesota. We're a statewide organization committed to advancing policies and programs that improve the health and well-being of Minnesota children, especially those who have been pushed to the margins. I'm here today to speak on behalf of our youngest members, infants, babies, toddlers, preschoolers, and their caregivers, many of whom are pregnant or breastfeeding. We're gravely concerned about the potential ending or interruption of critical supports available through WIC. The history, goals, and outcomes of the WIC program directly align with CDF's work to ensure that all children grow up with dignity, hope, and joy. Marian Wright Edelman, who founded Children's Defense Fund more than 60 years ago, was a leading national advocate for WIC during its formative years. Her passionate advocacy for child health, nutrition, poverty alleviation helped ensure that WIC not only was created, but sustained and improved over time. WIC is not just a program. It is a cornerstone of our nation's public health infrastructure and nutritional safety net. It was piloted in 1972 under President Richard Nixon in response to growing concern over malnutrition among mothers and children who were living and growing up in poverty. The first WIC site opened in Kentucky in 1974, and Minnesota joined later that same year. It was established as a permanent federal program in 1975, and for 5 decades it has served as a lifeline for families with low incomes, offering not only access to nutritious foods, but breastfeeding support, nutrition education, and referrals to a wide range of health and social services. Today, WIC serves nearly 7 million participants nationwide, including 101,000 Minnesotans each month. Nearly 60% of Minnesota's WIC participants are children who haven't yet celebrated their 5th birthday. And in 2023, more than 1/3 of all infants born in Minnesota were served by WIC, 38%. 62,000 babies were born that year. Each month, 22,000 women are served by WIC, and for many of the women who are part of the WIC program and are pregnant, it is their first step toward a healthy pregnancy. The evidence supporting WIC's effectiveness is overwhelming. Over nearly 5 decades, researchers have documented its impact on key measures of child and maternal health. There are 6 areas of impact I will highlight. I will go quickly because we really want to focus on where we do think the impacts will be if funding is not continued. But first, with healthier birth outcomes. WIC participation reduces premature births, babies born at low birth weight, and infant mortality. Improved nutrition. The program has helped reshape food environments for many, many families and communities. The third would be better healthcare access. Children in WIC families are more likely to receive immunizations and preventative care. Fourth, stronger cognitive development. Children whose parents participated in WIC during pregnancy score higher on developmental assessments when the children are 2 years old. Fifth would be in reducing health disparities and racial disparities, of which this committee knows well. We have significant disparities here in Minnesota. WIC participation helps narrow those disparities in both birth outcomes and in breastfeeding rates. And then lastly, the economic impact. According to the Center on Budget and Policy Priorities, every $1 invested in WIC saves up to $3.13 in Medicaid costs and yields $2.48 in savings through reduced medical, educational, and productivity costs. WIC is a medically necessary intervention. It's based on the principle that healthy food is medicine. Pediatricians routinely ask families about food insecurity during well-child visits because nutrition is foundational to development. Denying WIC benefits during a government shutdown is not just a budgetary oversight, it is a public emergency. And just lastly here, I do want to focus on what losing access would mean for children and families. And oftentimes, we're concerned about being hyperbolic as advocates. In this situation, this isn't hyperbole. Losing access to WIC would result broadly in increased hunger, poorer health outcomes, and greater financial strain for thousands of pregnant women, infants, and young children in Minnesota. Immediate consequences would be, number one, of course, would be food insecurity. Families will lose access to essential nutrition, including infant formula, and pregnant and breastfeeding women will face increased risk of malnutrition, which can harm fetal development and maternal health. Also, another immediate effect would be social and emotional stress, because we really can't fully quantify the social and emotional stress caused by the uncertainty surrounding the availability of these medically necessary benefits. In terms of the longer run, it depends on how long we're looking at WIC being interrupted. But in terms of what potential consequences would be, we can potentially see higher rates of premature births and infant mortality. And I don't know how, if we know that there is this direct link between the program and how our infants are doing, that we're not doing everything we can to ensure that this program continues forward. Second would be with health and developmental risks. Infants and young children are more likely to experience poor nutrition and growth delays, increased risk of anemia, lower immunization rates, reduced access to preventive care, and then again, increases in developmental delays because of the referrals that are made to Help Me Grow, referrals that are made for early intervention services. Next again would be a widening of the disparities that we already have in place. There would also be economic costs, not just for families who are under even greater economic strain and are already stretching their limited budgets, but also local economies will suffer too. We were in Mankato just yesterday talking about child well-being data, and there was somebody from the local food shelf there who talked about how with the funding that Governor Walz already announced in terms of going to for food support, food assistance, that they would likely see about $5,000 of that money. I won't talk about the food because I know that somebody else is here, but in terms of Congressional District 1, where we were, $93 million in benefits go to the local grocery stores in that area. Increased healthcare costs, and then lastly, greater pressure on emergency services. WIC is not optional, it's essential. Losing WIC supports would jeopardize the health, development, and dignity of many children and families in Minnesota and obviously throughout our country. These consequences ripple far beyond the kitchen, touching every aspect of life, from birth outcomes to school readiness to economic stability. WIC is a promise. It's a promise for more than 60 years, a promise that every child will have a healthy start, that no mother should have to choose between feeding herself and feeding her baby or young child, and that our nation and our state will stand up for its youngest members and carry them until they are able to crawl, walk, or ride a bike. We must keep that promise. And thank you for having this conversation, and thank you for your time and your continual commitment to our children.
Thank you, Ms. Fitzsimmons. Senator Nelson?
Thank you, Madam Chair, and thank you for that excellent testimony about WIC. We know how incredibly important that is, and you did a very good job of speaking to that. Remind me, it's a mix, I think, of federal funding and state funding. Can you elaborate on a couple things for me on that funding piece? And then also, I'm curious how much WIC funding is in jeopardy at this point because of the federal WIC funding to Minnesota that is in jeopardy because of the shutdown.
Ms. Fitzsimmons.
Yes, Madam Chair, Senator Nelson. In terms of funding, so I would say nationally, WIC is a $7 billion program. In Minnesota, for fiscal year 25, we received $151 million of funding for the program. I am not the person, unfortunately, to speak about those pieces. I can get that information, and I know exactly where it is because the WIC website is incredible. The information that's available on that website that we have here with the Minnesota Department of Health is amazing. So I know exactly where I can get that, and I will send it to you after the hearing.
Thank you, Madam Chair.
Senator Nelson.
Thank you so much. I recall it at one point, Minnesota, we funded WIC more so even than the feds required because we believe and we know how important that is. So I would appreciate that information when you get that. Thank you so much.
Senator McQuaid.